I'm excited. It's Heart Health Month. You know, it's interesting. As I was talking, thinking through today's topic, and we're going to talk about preventing heart disease, and this topic was really like changed my entire career. I still remember when I was a fellow, I was early in my career and I wanted to, I said, like all cardiologists, I wanted to put stents in everybody because that's what cardiologists do really well. And it was exciting. Like it was fun to save lives. When somebody comes in with a heart attack and, they're dying and you rush them off to the cath lab and open the artery and they're fine. Like I've just not had anything more immediately gratifying in my career. But
Right.
one day I started getting more and more interested in prevention, and one day I read the statistic that 80% of heart disease is preventable.
Which
And
is crazy
it
because,
was revolutionary
yeah,
revolutionary for me. Like I was like, at first I didn't believe it. I'm like, oh, come on, where'd this come from? Like, somebody's just pulling this out of a hat. But then I started looking at the research papers that were cited, and I'm like, oh my gosh, this is amazing. So it was, not only did it change my entire career, it really has become the foundation of what we do today, and the
it
foundation of
sparked
the
it.
Healthspan
Yeah.
team. You know, so
Yeah.
so I love this topic, and I love talking about it. And I often say this. Why doesn't everybody already know this? Like, why is this not taught in schools? Like, why don't we know that, these simple things are so impactful for our health and how long we live?
I know. It's like I know we say it again and again, but it's like 80% of heart disease is preventable. Why is it the leading cause of death in the world?
Yeah.
It's
Yep.
crazy. And I think it's just because like it's not common knowledge. Like it's nobody's fault. It's not stated enough, the things that you're about to talk about and the things that you can do to prevent heart disease from happening, and other
Yeah.
things as well. But heart disease, primarily because it's Heart Month, and Monday was Valentine's Day. So
Yeah, yeah, absolutely. So that's pretty much the nutshell. Like if anybody out there is interested in living a long, healthy life, they want to prevent heart disease. I think the real message, the importance today, or the message today is going to be really important for you, because we are going to talk about the scientifically proven way to lower your risk of heart disease by 80%, and couldn't be more appropriate for any time more so than Heart Month. So with that, can we
absolutely.
start, Rylan? Is it time?
Yeah. Yeah.
Okay, go
Hey
ahead.
everyone that's watching, just a quick hi. Yeah, we got some people on. Leave any questions or comments that you have down there in the comment section, and we'll be sure to address them and give you feedback. We'd love to hear it.
Great. So I'm going to start with I guess propose something for you to think about and consider, and that is this question: that if you want to live a long, healthy life, if you want 90 years or 100 years, if that's really important, if that's your priority, then I'm going to tell you the question that is most powerful in determining that is, what is your risk for heart disease? And I realize that you're going to say, well, he's a cardiologist. Of course, that's what he thinks is most important. And I admit I do have a bit of a heart focused view of the world, but today I'm going to give you 4 reasons why what is your risk for heart disease is the most crucial question you need to answer if your goal is to, feel better, stay healthier, feel younger, and live a long, healthy life. And the 4 reasons. Number 1, heart disease is the most common cause of death worldwide. And you probably already know this, but what you may not understand is how much heart disease there is out there. Chances of all of us dying of heart disease is about 1 in 3. So about a third of us are going to die from heart disease. That's about 600,000 people per year in the United States alone. That's about one every minute of the day. Somebody's dying from heart disease. Another way of putting this, kind of putting it in perspective, 1,600 people a day. That's about 4 fully loaded 747s every day. And it's not just an old person's disease either. Heart disease, about a third of those deaths are in people less than 70 years of age. So, dying from heart disease is really common. But the other part of this is that even in the second part of this is, even if you don't die from heart disease, it's still very likely that you're going to have heart disease in your lifetime. Research studies show that about 60% of us, so more than half of us, are going to have heart attack, heart failure, or a stroke in our lifetime. 60%. So it's not much of an exaggeration. If there's 3 people in the room, 2 out of 3 of you are going to suffer from heart disease. And the effect on our health, on our quality of our lives, even if it doesn't kill us, and we are gotten much better at decreasing death rates from heart disease, but we haven't done a very good job of preventing heart disease. And unfortunately, it is the major cause of disability and morbidity in our society. The third reason, and this is the shocking part that we have just been talking about, is that 80% of heart disease is preventable. Now, I know that's hard to believe. I mean, but most of the loss that we have suffered from heart disease, and likely it's touched all of us, right? Either personally, or somebody we love has either suffered, their health has suffered, or they've lost their life too young. Hard to believe that 80% of that is preventable. I mean, when you think about it, there's just in the United States alone, 600,000 deaths due to heart disease each year, 750,000 heart attacks, over 800,000 strokes, and about 1 million hospitalizations every year for heart failure. It's just really hard to imagine the number of lives affected by heart disease, lives that had ended too early, loved ones lost, their quality of life of suffering. And yet all of that suffering, that heart disease, or at least the 80% of that, would be preventable by 7 simple things, what American Heart Association calls Life Simple 7. So I'll just stop there and just ask you, Rielyn, and any comments from our audience. Doesn't those numbers just sound striking to you, like how inevitable heart disease may have seemed, but in fact, most of that is preventable?
Yeah, I mean, it really blows me away. Like, it is really simple too. I mean, there's a reason it's called Life Simple 7, and it just goes back to, it's not like common knowledge, like it's not widespread knowledge, and that's what we want to do and share it with you guys, is that this is really the key. This is the answer. I have a question for you though. Have you ever had an experience as a cardiologist when you, and I know this is kind of like a difficult topic, but you've lost someone, or someone has passed away under your care that that their death could have been prevented, and you felt strongly about that?
Yeah, I mean, unfortunately, far too common. One story in particular that was really instrumental in me kind of changing my trajectory, my dream job, to saying, what, there's a bigger role for me in this world. There's something more that I can offer. And it was a patient. I was on hospital service. I was the attending physician over the hospital service, and this youngish man came in. I was called into the emergency room, and this gentleman was in his mid-50s. And he was having a heart attack. So I get an emergency call. Hey, we have this very, sick patient. I rush in. I wasn't the interventional cardiologist. We rushed him to the heart catheterization laboratory. The interventional cardiologist opened his artery. but we couldn't get him back. We couldn't restart his heart. He kept going into, rhythm problems, and we kept shocking him, and it just, the damage has been done. And unfortunately, we worked, 3 or 4 hours. I mean, we had, shocked the heart, I don't know, 20, 30 times. Like it was, and we just couldn't bring him back. It was too late. And I remember going up to talk to his family about this. I wasn't really looking forward to that, of course, but I think it's an important part of what I do. And I asked the nurses to gather all the family in a room, and I walked in, and it was his wife and his 3 grown children. They were, young adults, and his mother. And I had to tell them that he didn't make it. That despite doing everything we could, he didn't make it. And the angst, the pain, I mean, a mom losing her child, the children losing their father, wife losing her husband, and one of the sons just started punching a wall. It was, and as we talked, as we just working through things, I realized that what happened to him was completely preventable. Like, he was a busy man. He was taking care of his family. His family, he loved, they loved him, but he wasn't taking care of his health. And unfortunately, the reality of that was that family suffered a devastating loss. So yeah, very, very, very poignant moment for me, and one where I realized I can't just sit here and wait for things to happen. That's kind of healthcare's role, right? It's somebody called it whack-a-mole strategy, like, that medicine sits and waits for an illness to come up, and then we beat it down with everything we have, and then we say, okay, we got that one beat, now let's just wait for the next thing to come up, and we just keep repeating that until failure. And I realized there's got to be a better way to that. So
Yeah.
yes, that was a powerful time for me.
Well, thanks for sharing that. And the reason I asked is just because, like, as a doctor, I know that's something like a burden that you take on, like it's a form of service that you give, of course. And enduring like losses is part of that. So I know that has played a powerful role in your life and you doing what you do now.
Yeah, and even more so these days. I mean, love to all of people in healthcare out on the front lines.
Oh
It's
yeah.
been a tough time for everybody. So, part of what we do, we want to improve lives. I'd love to improve people in healthcare's lives as well, because they want to take care of healthier people's. They don't want to be, having to relay these bad results, bad outcomes to family
Yes.
members either. So transitioning to the positive side of this, 80% of heart disease, 7 simple things. This is the foundation of the Healthspan 10. Like, when we talk about the Healthspan 10 as the 10 most powerful factors for a long, healthy life, it's the foundation of that is Life Simple 7, which is the 7 factors that prevent 80% of heart disease. And those 7 factors, the first 4 of these are kind of the indications that our metabolism is not working well, when they're not normal. So, when people say, okay, well, how do I know if my metabolism is abnormal? If you have one of these 4 things, then your metabolism is likely not normal, and you're at higher risk for heart disease. And those 4 things are blood pressure, high blood pressure. About 46% of adults now have high blood pressure. High cholesterol, about 100 million out of the 240 million adults have abnormal, unhealthy cholesterol levels. Body weight, more accurate than just how much do you weigh is your body composition, how much, your percent of fat, your abdominal circumference, like how much weight are you carrying around the middle. And then blood sugar, abnormally high blood sugars. Those could be either diabetes or pre-diabetes, or sometimes called insulin resistance. If you have one of those, then your metabolism may not be healthy. If you have several of those, you have metabolic syndrome, what doctors call metabolic syndrome. Those are the driving factors behind heart disease. So those 4 are part of Life Simple 7. And then the 3 other things are more how do we fix our metabolism? And that's in the Life Simple 7, it was not smoking, healthy nutrition, which in our program primarily starts with the foundation of that is minimizing highly processed foods, and then being physically active, which is meeting minimum recommended exercise recommendations. 150 minutes a week of moderate activity or 75 minutes of vigorous activity. So checking those factors, check those 7 boxes, those people have 80% less heart disease than those people who don't check those boxes. Pretty powerful. Pretty powerful. So, but that's not all. We'll do Monty Hall here, but there's more. Number 4, moving to the 4th reason why. What is your risk of heart disease? The most important question in determining the length of your life. We already said heart disease is the #1 killer. Even if it doesn't kill you, it's likely it's going to affect your life, and because most people are going to have heart disease in their lifetime. It's highly preventable, but here's number 4. Number 4 reason why that is such a powerful question is because, very interestingly, preventing heart disease is also the most effective way to prevent the other things that kill us and affect our health. Cancer, stroke, dementia, all on that list. If you check off those boxes of Life Simple 7, you also lower your risk of stroke by 50%, by dementia by 37%, and by cancer by 33%. So very powerful. If that's your goal, to live a long, healthy life, Life Simple 7's great place to start, lowers the risk of all of those things, and in the research studies add an additional 15 years to your life. So very powerful message for Heart Health Week.
Yeah, absolutely. And it's not just, preventing these diseases, it's feeling better in the moment, like getting that peace of mind that you're doing everything you can, and you're feeling good. You have more energy when you're optimizing these things. You feel stronger. You feel happier. The healthier you are, and the more you're able to, when you're healthy and you're taking care of yourself, the better you're able to take care of your other relationships. And it goes full circle. It's not even just the risk factors. And so I just had to add that in there. Like, I can't tell you how gratifying it is to have a client say, like, you know what, like in the first week, like I haven't lost as much weight as I wanted to yet, but it doesn't matter because I feel so much better. I know that it's going to happen. And like, that is so powerful, because it's like, in the end, like weight is weight, and there's like a healthy BMI or not, but what matters is if you feel good and if you feel energized and if you can do the things you want to in your life that make your life full, and you can cater to your relationships that mean the most to you in your life. That's where it starts, and then it's like, you're not even gonna have to worry about stroke, cancer, dementia, Alzheimer's, things like that when you're taking care of yourself.
Yep, it's incredibly powerful to know the power that you have, that it's not outside of your control to live that long, healthy life. I heard something just this morning, Rielyn, I'll share with you, that just stunned me, and I think illustrates the exact point you were just making. There's this concept among health epidemiologists. It's called DALY, DALY, and it's an acronym for daily average life expected, or daily average life years. And what it is a measure of the number of years of life lost by either premature death or just not living your best health. So disability, disease, those kind of things. And what do you think the current in the United States number of years, average years people lose And I'm sorry, it's not daily, it's disability adjusted life years. I forgot what it, I forgot what it was called. What do you think the number of years on average are lost in the United States due to early death or disease and disability?
20.
Yeah, 23.
Wow.
23. Yeah.
That's like almost as long as I've lived.
Yeah. I mean, it's a third.
I'm a little
So
older than that, but
a third of life, right? Like, I mean,
yeah.
average life expectancies in the, around upper 70s. I mean, that's almost a third of life is on average, people are either not living it or they're living it with significant disease and disability. And, and when you're looking to get healthier, it can get real confusing. We
Hmm.
did this recently, did the Google search, how to live a long life, and got 9 billion results.
Yeah.
But here we are down to, what we talk about, the Healthspan 10, like, though that's the foundation. That's before we get into anything else. If we can get to the foundation of living of those Healthspan 10,
Hmm.
these are the benefits of that 80% less heart disease being top of that list.
Absolutely. Yeah. And if you guys want to read more about the Healthspan 10, we put up a website where you can go and just, get Dr. Hurst's like entire written guide on it. And so I put it in the comments, but all you have to do is go to healthspanmd.com/10, like TEN. So you can read more about the 10 and these, the AHA's simple 7 are included in that 10. That was kind of the basis of it. And then when you did your additional research, right, you found that there's 3 more that are really crucial to just like the icing on the cake for the quality of life piece.
Yeah, Life Simple 7 is what's great from a research standpoint, because you can, ask questions like through a questionnaire and then analyze that in large numbers of people. But when you're a clinician, as I am, you take care of patients, you realize the reason that some people aren't losing weight or getting their blood pressure better or getting their cholesterol better or getting their blood sugars better. Sure, it can be nutrition and physical activity and toxins like tobacco, but there are other factors that often need to be fixed before you can get those good results you're looking for, and that's sleep,
Hmm.
stress, and connection. Not just social connection, but also connection to your purpose, to the things that are important to you. When you have all 10 of those working, then that's when we can really get people that promise of a long healthy life that they're looking for.
Yeah, that's so true. It's like I just had this thought. It's like almost like if you don't get like sleep, for example, it's and you're trying to fix the other things first, it's almost like you're just running on a hamster wheel, because it's just like if poor sleep is just going to keep knocking you down until that gets optimized, then it comes to fixing those other things like nutrition and physical activity. But if you don't have like the sleep there, then that's always going to be an issue.
Yeah, I had to learn that. I mean, what we talk about a lot is fixing your metabolism, right? Like, that's the
Hmm.
key. And when we fixing metabolism is, again, the blood pressure, the cholesterol, the weight, the blood sugars. But what I had to learn as a doctor, as a clinician, was that if the sleep and stress are not addressed, the metabolism is set up in a way that it's virtually impossible to lose weight, virtually impossible
Yeah.
to change the other things that are so important. So that's why it's a Healthspan 10 and not the Healthspan 7. And so with that, I guess I will end on Happy Heart Month for everybody, to you,
Yes.
Rielyn, as well. And
Happy Heart Month.
the goal of Heart Health Month or Heart Month is to build awareness of the importance of heart health. And if you recognize that you need help with lowering your risk from heart disease or getting your metabolism fixed. If you've made the decision that you're not going to follow the norm of a life that is, potentially up to 23 or on average 23 years less quality years than you might be able to have, and you're looking for expert guidance, here's how we can help. And certainly download the 10 things. Rielyn had mentioned that, but if you're ready to take even a further step, schedule a strategy consultation with us. You can do that at healthspanmd.com/talk. What we will do is just get on the phone with you and talk about what's personally holding you back, how you can start applying these ideas to your health, and show you how you can improve your metabolism and achieve your health and weight goals today. So, and we do this for free because we love to help people. So if you're ready to book that strategy consultation, just go to healthspanmd.com/talk. We'd love to talk to you.
This information is for educational purposes only and is not medical advice. Don't make any decisions about your medical treatment without first talking to your doctor. Thanks for watching, and if you want to learn more about living a long, healthy life you love, click the link below to learn more about how we help people increase their health span. And if you like this video, hit the like button below, share it with your friends, and be sure to hit the bell and subscribe.